Welcome back to the Groundless Ground podcast. I'm your host, Lisa Dale Miller. This is the second in our series of dialogues on embodied contemplative interventions. My guest is clinical psychologist and researcher Richard Miller. Richard is the founder and executive director of the Integrative Restoration Institute. For more than 40 years, Richard Miller has devoted his life and work to integrating the non-dual wisdom teachings of yoga, Tantra, Advaita, Taoism, and Buddhism with Western psychology. Our dialogue begins with a description of post-traumatic stress disorder, or what's colloquially known as PTSD, and then Richard offers an in-depth look at the extensive use of the iRest Yoga Nidra program in military contexts and the VA for mitigating the negative symptoms of PTSD. Richard and I encourage anyone who suspects they may be suffering with PTSD or is currently dealing with PTSD to seek appropriate treatment. I am so excited to have you here, Richard. Thank you so much for being on the Groundless Ground podcast.
Couldn't think of a better place to be.
iRest Yoga Nidra is now well known and fairly well integrated into the military as well as the Veterans Administration for helping veterans to recover from PTSD. Would you agree with that statement?
I would. In the United States, we're in over 85 VA settings of one sort or another with either active duty veterans or reservists, and we're working in hospitals, clinics, and private settings with both military and then general population throughout the United States, Canada, Europe, Australia. We're coming into China now and Japan. So it is quite worldwide.
This is fantastic. I think it would be wonderful to start by talking about PTSD. There's a lot of information and misinformation out there about PTSD. So I thought maybe I would just say a few things so that the people who are listening who might not know what PTSD is, we can give some clarity about what we're actually talking about. Over 200 million people will probably experience a traumatic event at least once during their lifetime. 40 million of us, maybe 20%, will go on to develop symptoms of PTSD from those traumatic experiences. And among U.S. combat veterans, the number of cases of PTSD is much higher than that, certainly much higher than 20%. Wouldn't you agree?
I would highly agree with that. It's probably in the order, if people have been in a combat situation, 40% or higher.
Yeah.
And we want to differentiate between post-traumatic stress disorder and post-traumatic stress, because people can have symptoms of post-traumatic stress. They may not manifest a full disorder, but that doesn't mean that their system hasn't been overactivated, and so they're carrying symptoms of post-traumatic stress.
Most people think something really awful has to happen in order for a person to develop post-traumatic stress disorder. But the truth is, a physical injury or serious medical diagnosis, experiencing or witnessing physical violence, abuse, disasters, natural or otherwise, even witnessing or experiencing an automobile or train or plane crash can lead to PTSD. War, combat, terrorist events can lead to post-traumatic stress disorder.
I'd say even someone who is under ongoing stress in an office, if it's prolonged enough, or in a marital situation or some situation where they're not able to avoid the stress, can lead to stress syndromes and post-traumatic stress disorder.
Sometimes my patients will ask me, how do I know if I have PTSD? And there is a simple list of symptoms that's easy to identify. Things like you're having trouble sleeping, your emotions are dysregulated, or maybe you have a sense of feeling numb all the time, a tremendous amount of hypervigilance, feeling on guard most of the time. You could have flashbacks or painful memories of a stressful event that don't fade. Some people have a constant sense of fear. Often, if people have those, and then I say this one, and then they say, oh my gosh, I have it. And that last one is you might be avoiding places or people or things that remind you of a distressing event. That's how you know you have the disorder rather than having just some tremendous stress left over from some kind of extraordinary experience that you've had. Would you agree?
I would, and I'd add one more to that list, which is the tendency to self-medicate using drugs, alcohol, or some alternative substance of whatever kind to dampen one's feelings.
Yes, that is a tremendous problem. The other interesting thing is sometimes I have people come to see me and they tell me they've been diagnosed with depression or anxiety when in fact they're actually suffering with PTSD.
Yep, makes sense.
Do you find that sometimes the people you work with have been misdiagnosed and they don't know that they have post-traumatic stress disorder?
Either misdiagnosed or they misdiagnosed themselves. They come in thinking they're depressed or anxious or fearful or just having a difficult time adjusting for whatever reason. And then when we go into their history and we begin to work with them, we'll see that there are these moments in their life where there was some catastrophic shift or change, which led to their having these symptoms that have given rise to this disorder.
I'm curious, what led you to think that a yogic practice might be a method for people to be able to heal some of the symptoms we've just mentioned of post-traumatic stress disorder?
I was fortunate, I would say, looking back 45 years ago when I started learning the art of psychotherapy, that my first mentor was a woman who came from the Far East, gotten her degree at Berkeley, but she'd grown up in a Buddhist yogic community in the Far East. And when I started studying and learning from her, there was an integration from that very first day that I met her and started working with her back in 1973. Right from the get-go, when I was training and working with people, I was learning how to integrate these different principles from a yogic or spiritual perspective to a classical Western psychological perspective. And so we were really looking at who's the person, what are they coming up with, and what is the best intervention that will help them heal. So I began to see back in the early 70s that these interventions, which now we consider, more alternative and were not in vogue back in the 70s, were very effective, both working in a public clinical setting, a private clinic setting, and in a psychiatric hospital. So I had access to a whole range of patients, from people who were just having general anxiety or a light depression to people who are actually schizophrenic, psychotic, and going through major depressive episodes.
You have just said that we're talking maybe 30 years ago. You were already looking at some of the Eastern practices as methods to help people with mental illness here in the West.
45 years to be exact. Yes.
So for you, none of this is new. And I think that's one of the things that's so powerful about how you manage to create an integration of the Eastern practice of Yoga Nidra, which we are going to explain in a moment, into clinical settings that, frankly, are as conservative as you can get. Military settings, hospital settings. These are not settings that generally are open to what's generally thought of as alternative methods.
And I feel fortunate that I found myself in situations from as early as 1973 with people who were very open to these kinds of explorations. When I even worked in the psychiatric unit, the people I was working with, that was 1975 and 6, they were very open to looking at alternative practices. They were more interested in what works and how can we help these people heal and get better than a specific approach. So they were very open. It's also in 2004 when the military approached me to examine the protocol that I had developed. Now we're in the wars from Iraq and Afghanistan and Gulf Wars. veterans and soldiers are coming back with tremendous post-traumatic stress, and the normal interventions are only 40 to 50% effective. The military was very open to exploring complementary or alternative practices. They just wanted to see how can we help these service members heal.
I just use the word Yoga Nidra. Mostly when people hear yoga, they think of body postures and stretching and moving. Would you describe what Yoga Nidra is?
Succinctly, I think of yoga as our ability to experience a deep interconnectedness with ourself and the world around us, where we feel a sense of harmony, both within ourselves and on our interactions. Nidra is an interesting word in Sanskrit. It means sleep, but it actually means a changing state of consciousness. So that could be waking, dreaming, dreamless sleep, or it could mean an emotion like sadness, anger, happiness, grief. So Yoga Nidra, when you put them together, actually means the ability to feel connected within ourselves and in harmony with the world around us, no matter the changing state of consciousness that we may be experiencing. We could be happy, we could be sad, we could be experiencing post-traumatic stress, and yet still find a deep sense of connectedness with ourselves and the world around us. And this is interesting because paradoxically, one of the things that post-traumatic stress does with people is it disconnects them both from themselves, their internal experience, and it disconnects them from their social relationships and a sense of connectedness with the world around them. Yoga Nidra helps restore that sense of connectedness, even as we may still continue to experience some of the symptoms that come with post-traumatic stress. So Yoga Nidra is basically an approach, very ancient, that helps a person restore that connection with themselves and in all their interactions with others and with the world around them.
Traditionally, Yoga Nidra is done in a lying down position, and the practice is usually a guided practice. So the body is still, the mind is moving. There's a deep state of rest, so deep it's almost what's called a low dorsal state, which is the state where the dorsal vagal system goes into a deep rest and digest so that cellular repair can actually happen. It's often what happens when we sleep. And yet the definition that you just gave of Yoga Nidra included so many more things than just lying down, body still, deep rest, mind alert and awake.
When we initially learn the practice, we are typically in a lying down position that facilitates a deep sense of rest. But I also teach it in a sitting position, a standing position, and when people are walking around, I want them to learn the approaches or the tools in every position they might find themselves in. The understanding here is if we learn a technique in a particular posture, say sitting, it becomes state specific where we might leave the sitting position where we're feeling quite calm and peaceful. The moment we stand up and we change our position, however, we leave that state behind. So in teaching Yoga Nidra to people, I'm teaching them to embed it, embody it in all different body positions, all different types of moods.
So would you say that that is the key component that differentiates iRest Yoga Nidra, your method, from traditional Yoga Nidra practice?
I would say that's one of them. When I was going into research with the military, they actually asked me to change the name. I have a wonderful video of a Marine saying, "We're Marines, we're military, we don't do yoga, that's for sissies." So the military actually asked me to change the name, and I came up with integrative restoration. Integrative because it integrates our sense of psychological selfhood and well-being. Restorative because it restores a deep sense of wholeness and well-being back to health. and iRest, the small I for integrative and rest for restoration. The military came back to me and said, we love iRest. We can do that. Always funny to me. I love telling the story that 4 years after our original research, they came back to me and said, we like what you're doing. We see it's highly effective. You can call it anything you want. So we do call it integrative restoration iRest when we're serving military because they like the name. But the traditional name is Yoga Nidra. And iRest has a number of ways it differentiates the way that I teach it as the iRest methodology. One is we teach it in all different positions. We are highly interested in integrating it into the world, into daily life. The way that I teach it is as a comprehensive system of healing and well-being, and I would say restoring one to what I think of as our innate sense of well-being and wholeness. So I'm interested in helping people not just heal, but come into tremendous well-being, resiliency, and being as awake and embodied a human being as possible.
You have actually written a phenomenal textbook that lays out the entire iRest program almost so beautifully that someone could pick it up and practice the iRest program. In that book, you have something called the 10 Tools of iRest. And I thought it might be really wonderful for you to explain some of the tools that you feel are the most important part. I'm sure it's hard for you to pick out one.
The intention behind the book, as you say, was really to showcase the methodology so someone could learn it themselves. So the 10 steps, and let me see if I can take the listener through a little bit experientially, so it's not just intellectual. Every journey, whether it's healing through post-traumatic stress or getting up out of bed in the morning, I think should start with what's my intention for healing or for the day ahead of me. So when I wake up in the morning, first thing I do is think, what's my intention for today? What's driving me? What's motivating me? So in iRest, we start with, what's your intention for doing this practice? The intention sets the tone. The second step is a little deeper inquiry. But what's your intention for life? So I call that the heartfelt desire. In the military, they didn't know what to do with heartfelt desire, but they liked the word mission. So I say to military when I'm working with them, what do you think the mission is that life has sent you on? What is it that by achieving it, you might say, you would find deep value, meaning, and purpose in your life? Because we know that one of the things post-traumatic stress does, and stress in general, is it disconnects people from a sense of value, meaning, and purpose in their life, and people can begin to feel adrift. So the first two steps are to help a person recapture a sense of value, meaning, purpose, and intention that we're going to carry with them through the practice. The third step is nourishing a deep sense of what I call inner resource. But when you feel really deeply at rest and secure, how and where do you feel that in your body? Many people say they feel a sense of warmth in their belly or their heart, and they use different terms. The term I use is a sense of deep core well-being. So throughout the practice, we are continually asking a person to come back to this sense of bodily felt well-being. It can be associated with imagery, like one person, he saw an image of a tree with the leaves blowing in the wind, and as it was moving, he felt very calm and at ease. Another woman who had post-traumatic stress said she was holding on to the hand of her 3-year-old daughter, which gave her a sense of peace. Another fellow in the military said he was in bed making love with his wife, and the guy next to him said he was holding on to his weapon with his finger on the trigger, the safety off. And we asked all 4 of these people, does this make you feel very secure and at ease? And they all said yes. So very different imagery that elicits a sense of well-being. So this third step we interweave through the next steps. Body sensing and breathing form the fourth and the fifth steps. We want a person to access the ability to feel sensation in their body, because everything we experience, whether it's a thought, an image, a memory, an emotion, comfort and discomfort, they're all sensations. So we want people to access that sensation, because one of the things that post-traumatic stress does is it tends to make people numb to their experience. So we want to reawaken the body. And we also use the breath to do that, but more so we're inviting the body to release feel-good hormones like serotonin, oxytocin, GABA, antidepressant hormones that are natural to our body. So we can release those through breathing, and certain rhythms of breathing help a person find deep core relaxation. The next two components work with learning how to be with and welcome emotions and all sorts of cognitions, thoughts, memories, images, so that we want to be able to have full access to our emotional and cognitive aspects, treat them as messengers. I have the view that every sensation, every emotion we experience, every thought or cognition is actually a messenger that if we attune to it correctly, they're here to help guide us on our way towards health and wholeness. So we're giving people essential tools of how to be with an emotion, how to process it, digest it, metabolize it, and let it move through. And the same with thoughts and memories. And people who have post-traumatic stress often are having flashbacks, memories that keep them hijacked, helping them learn how to let go and metabolize these memories so they're no longer bothering them. The last two aspects, or actually the last three, one is learning how to have a perspective. So when we're having a thought or an emotion, there's a tendency to get so involved in it, we fuse with it. In this tool of iRest, we're learning how, in a way, to step back, gain perspective, or we might say awareness of it, so we don't feel so hijacked by our emotions, our thoughts, and we can have an ability to see through them and find actions that feel in harmony with ourself and life. The next aspect is actually learning to evoke a tremendous sense of joy and well-being in the body. It's kind of hooked into the initial inner resource, but it even goes deeper, what I call to discover within ourselves an unchanging joy and well-being, no matter the situation we're facing. This can be paradoxical because we can be in great grief and yet feel joy. We can be in a moment of anger and yet feel an internal sense of equanimity or peace. And the last stage of the iRest is integrating these different tools into daily life situations so that we're learning to basically engage Yoga Nidra, this practice of iRest, 24 hours a day, 7 days a week, 365 days a year. So it becomes a way of living our life that's integrated into every situation and activity we find ourselves in. So 10 tools: intention, heartfelt desire, using an inner resource of well-being as a grounding force, no matter what we're experiencing, then sensation, breath, sense of joy, and a sense of perspective, all of these which we're integrating into the world.
As you were describing that, I was remarking internally that there's this back and forth in the method of iRest from, I would say, the cognitive tools of Western psychology, some of the cognitive behavioral techniques of being able to notice thoughts, work with thoughts, and then this sort of baseline familiarity that I don't really think has ever been in Western psychology. Sense that there is something other than the ego that is a platform for well-being and refuge.
Western psychology is predicated on the concept of ego identity, taking oneself to be a self separate from other selves around us. That creates a sense of separation. post-traumatic stress, where a person can feel not just disconnected from the people around them, very separate from the world, but also separate within themselves. The yoga psychology is based on a very different premise, that we're all interconnected with one another. And so we're constantly looking for ways to nourish that interconnectedness. Innate within us, all of us, is a sense of wholeness, a sense of well-being that actually can't be destroyed or touched. We can lose touch with it, but that doesn't mean it's been hurt or destroyed. So I like to think of, say, Yoga Nidra and these types of approaches as helping a person recontact that basic core sense of wholeness or wellness, so that then we're healing from or out of that sense of wholeness or wellness. And I have found in the work that I've learned to do and work with the people that it's very easy actually to help a person reestablish a connection with that inner sense of well-being and wholeness from the very first session we're working together with. And then it's a constant helping remember it, remind it, nourish it all through the healing processes. We're looking at different premises than traditional Western psychology. One is we're all connected. And then one other thing struck me when you were talking, which is in traditional Western psychology, when they're working with emotions and thoughts, they don't always understand what I call the principle of opposites. If we are just working with a negative emotion, we can get hung up or hijacked in that negative emotion. If we only try to work with the opposite of it, a positive emotion, we can get hung up there. So in Yoga Nidra, we actually have a whole set of tools where we work with what are called opposites. If they're working with a difficult, challenging emotion, thought, image, memory, we're helping them locate the opposite and then welcome both in at the same time. Working with opposites is a major part of our approach, whether we're in sensation, emotions, or working with thoughts, memories, or images. So we have these three basic core principles: one of wholeness, where we're helping a person find their core sense of wholeness and well-being, very first session. The sense of interconnectedness, that our work isn't based on a sense of separation or ego identity, but something that's very different, and then working with opposites.
Even if they've done a lot of prior psychotherapy, people have a tendency to only think about what their mind is telling them. And they really don't experience the basic minimal sense of I, meaning, so I can give maybe people an experience right now. See if you can feel something as simple as the weight of your body sitting in the chair. And if you're in a car, you can feel the weight of your body sitting in your car seat.
Or the sensation of both hands at the same time.
Mm-hmm.
That's a basic quality of sensation, the weight and heaviness of the body, or the feeling of the hands, or the feeling in the jaw or mouth. We all experience, can't be denied.
And then what people will do is, especially if I take them into their body, which I generally don't do first, because people have all kinds of difficulties with their bodies. So if I take them into a feeling of just weightedness, or I take them into one of their five senses and just ask them to see, it doesn't take very long, maybe 15 seconds. And as I'm watching them do whatever I'm asking, suddenly the chest just starts to open and expand with a deeper breath and then a deeper exhale. And they don't have any idea this is happening. None. And I will ask them, just for a moment, shift your focus and just notice how your body is feeling. And inevitably, they always say, calm. I feel calm. And it doesn't matter how agitated they were prior to me doing this. And normally I will do this if they're experiencing a lot of overactivation, either in the nervous system or even racing thoughts, something like this. And they're stunned because I didn't ask them to relax. I didn't ask them to calm down. All I asked them to do was shifting into a sense of just a basic body here, an organism here in the middle of whatever else is around. There's a basic sense of connectedness that comes from that. That's easy for people. They don't have to go to this big idea of interconnectedness, interdependence,
No.
spirituality. It's just, right, I'm here in a chair and this is a room, and there's no separation between my body, the chair, and the room.
We start by saying, can you sense your jaw? And automatically the teeth will begin to soften. The mouth fills up with sensation. Can you feel your skin of your face, your forehead, your shoulders? I actually never use the word relax. I just ask people to, can you sense your jaw, sense your shoulders, the natural weight of your hands? And as you're saying, we're calling foreground natural sensations of aliveness in the body. And when I've done that, and I've gone through very quickly from the jaw down to the toes, and I ask a person, so what's happening now in your thinking mind? They'll always say, well, it feels very calm. So it's a wonderful, very quick way, especially when we then add in a little bit of breathing with it to soothe and relax the thinking mind. As you say, help reestablish very quickly a sense of connectedness here, now, this moment. And then I can add in, can you hear the sounds that are present? And we open up more and more sensory perceptions.
What's most fascinating about the fact that the military has embraced iRest, Yoga Nidra, is that exposure therapy appears to still be the therapy of choice for military people who are suffering with trauma.
It's true. And the statistics on exposure therapy is it's roughly 50% effective. One veteran from the Iraq War, I thought, offered one of the best testimonies I've ever heard. He said, of all the treatments that I've had in the military and in the VA, they all emphasized what was wrong with me, from exposure therapy to behavioral therapy to anything that they were going through to help them heal. He said, iRest program was the first that was emphasizing from the beginning what's right with me. And he added to that, why would I want to face my worst nightmare when all I'm thinking about is what's wrong with me and how terrible I feel? Now that I know what's right about me, this innate sense of well-being, he said, I'm willing to face my worst nightmare. Exposure therapy has a tendency to reactivate the nervous system. And so in a way, it's like mini re-traumatizations. And we are really go very carefully and say our approach with the iRest, we do not want to reactivate the system. We want to offer the system a very calm, soothing quality of ease, as then we're beginning to walk through the difficult emotions or thoughts or memories that are associated with the post-traumatic stress.
Have you ever heard any of the military, ex-military veterans who've done this say that they're worried they'll lose their edge if they become calm and soft and drop into a sense of well-being?
I think it's a concern that probably many people, including artists that I've worked with who've had post-traumatic stress or depression, they're afraid they'll lose their edge with their art. The military initially were very skeptical because they thought it was a kind of a woohoo kind of an approach. And I had some wonderful videos of Marines and folks from the Army and the Navy after their first session when they're saying, I've never felt so relaxed in my life, or I got the first night sleep since I was in Iraq or since I was in Vietnam 40 or 30 years ago. So once they understand that, no, this isn't going to help them lose their edge, it's actually going to reconnect them, and they get on board very, very quickly. And it's often why in military situations, I always like doing this in groups, where when newbies come in who haven't experienced it, we educate or we help people who have learned this approach to then in turn show it to their brethren or their brothers or their sisters and help them say, you need to try this. It's really a great intervention.
So should you and I tread on this territory that seems to be treaded quite a bit by the Buddhists around the use of mindfulness in the military and how, quote unquote, they're making better killers with a set of practices that come from a tradition with which the first principle is nonviolence, non-harming. Not that I am espousing this particular point of view. I have my own point of view because I've worked a lot with veterans and also with active military on medical disability.
When I was first approached by Walter Reed Army Medical Center, I met with about 25 military leaders. These were colonels and lieutenants and sergeants and master sergeants. And they asked me that question. They said, if our men and women do this approach of Yoga Nidra, what's going to happen? And I remember thinking to myself, do I tell them the truth? And I quickly realized they're going to find out anyway. So let's speak the truth. So I said, this is exactly what I said. Some are going to go through this approach and realize they cannot hold a weapon. And these are people who you want to get out of the battlefield. You want to get them into medical facility or driving cars or send them back to civilian life, because these are going to be people who can't do the job. They're going to be a danger to themselves. They're going to be a danger to their peers, and they cannot do the job. Others, they're not doing it out of hatred or anger, vengeance. They're doing it because it needs to be done. And the moment that they're done, they're going to put their weapons down, go across the battlefield, and help the very people that they were just at war with. The military leaders who were in the room, and I remember feeling the hair on the back of my neck stand up when they said, this is exactly what we want to hear. We would like to get those who can't do the job out of the job as quickly as we can. We want to try to find those who are in a way born warriors, that this is a job they're here to do. I don't like war. I don't like violence. But if there is to be a war, then we need to do it not out of anger or hatred, but out of a sense of duty and harmony within ourselves. In terms of Yoga Nidra as a science of meditation, it's helping people become very good human beings, operating on all cylinders, where they're able to make ethical decisions. They're going to be moral, ethical human beings who are able to discern an order that's being given that's in harmony with the job they're needing to do versus a decision that they may be asked to do that is unethical. And we see that in every war. There are unethical actions that are carried out by people who kind of get hijacked by their emotions in the moment. We saw that at My Lai in Vietnam, and we've seen it in other incidences in Iraq and Afghanistan. We want soldiers who don't just follow orders. I liked that the military leaders who were in the room that day, who said, one, we're not interested in our boys and girls going to war. If we have to, then we have to do it, but we want them to be able to make ethical decisions.
The military has rewritten their ethics in the last 4 years.
They've rewritten their ethics, and they also rewrote a whole document which they call Total Force Fitness, where they've integrated a sense of spiritual health. The vow that I've taken is to help people end their suffering.
Dogma often gets in the way of being able to apply methods skillfully. Frankly, the yogic tradition, the Upanishadic and Samkhya tradition, this is much less an issue there than it is in Buddhism, because the Buddha was very clear about violence. And if you read the Bhagavad Gita, Krishna spends a long time in the Bhagavad Gita training Arjuna in the dharma of a warrior and the true nature of experience and how to be able to
bring these two things together so that there's ethical conduct, but a sense of what's actually occurring. And Buddhism doesn't have that so much. Buddhism is much more, I'd say, black and white, that suffering has many forms. And when you are alleviating suffering, you are trying your best not to be a source of creating suffering in the alleviation of suffering.
Violence, to me, occurs when we're actually out of touch and out of harmony with ourselves and the world around us, and we've gone astray. In yoga, though something is determined as wrong, if it's taking you away from your deepest sense of self and that connectedness with the world around us, you go away from being in harmony. Say in war, where it looks violent from the outside, but it's keeping it in harmony with what is being called for in the moment. I take something like Hitler. If I was in the room with Hitler and I knew where he was going with the outcome that he was moving forward, and I had a gun, I would hope I would take that gun and shoot him. Now, is that an act of violence? Or is that an act that I would feel in deep harmony because it would end the suffering for a lot of people to come? No easy answers here.
No.
When I'm working with the person as I was today, and they're experiencing a difficult, challenging situation, I'm trying to help them discern what feels right and what doesn't feel right.
Yes.
And I know that post-traumatic stress disconnects a person so that they can't make that discernment anymore.
Sometimes patients will come to me after having done a lot of trauma therapy, and yet their entire identity is fixated on this trauma. It has characterized their entire life, and it has dictated what they can do, who they think they are, and they have absolutely no self-recognition of this fact because they are so over-identified and coalesced with this identity. You call it the trauma of me, which I think is just such a great term for it. And I imagine that in especially the military context, when you've been working with veterans and the people who've been doing studies, especially Vietnam veterans, I imagine many of the people that come to do the iRest Yoga Nidra program have been fixated in their trauma identity for a very long time.
And it creates a sense of this is the way that I know, it's familiar, and there's a tendency to stay in that groove.
Yes.
That fusion with the emotions or the different memories. Yoga Nidra is a kind of a science that helps people break that fusion, gaining that kind of perspective, helping a person gain a bit of distance so they can see things they couldn't have otherwise seen and break that identity and gain, we might say, a new identity with a larger sense of self.
And you and I will agree, we are not discussing alternative thoughts, the way cognitive behavioral therapy talks about alternative thoughts.
So say more about that. Give an example for the listener when you say alternative thoughts.
So sometimes in cognitive behavioral programs, what they do is they will help people identify the assumptions, usually very negative assumptions, these habitual stories they tell themselves, thoughts they tell themselves, and they encourage them to come up with an alternative thought, something that isn't the habit thought.
Right. And we have a slightly different approach, similar but different, which is when a person describes to me a particular thought or belief or emotion, I first ask them how and where they feel in their body when they're experiencing that thought, that belief, that emotion, or that sensation. Then I ask, if you had an opposite to this emotion, thought, or belief, what might it be? And if you were to experience that, how and where in your body might you feel? Then I ask them to contemplate the first and then go back to the opposite, back and forth, back and forth, back and forth, and then to hold both at the same time. In the Yoga Nidra approach, we're not, asking them to believe the opposite or to, contemplate it as that's their new reality. We're actually using it to unearth a whole new perspective that feels much more in keeping with what they need to be doing. As a person is more able to access initial stages of well-being, but ultimately we are nourishing the sense of being awareness with whatever else is arising. And a person all of a sudden can find themselves very quickly in a very peaceful, unagitated state, even though agitation or some disturbances may still be going on in their nervous system.
That's what is colloquially called resting in awareness.
Resting and abiding, first in awareness and then ultimately as awareness.
We're coming to the end of the time we have together. Would you like to tell people how to find out more?
My website, iRest.org. We are a nonprofit and we do work all over the world and do trainings throughout the United States, both training teachers as well as teaching people these principles through workshops, immersions, classes, and online offerings. So if they go to the website, iRest.org, there are actually some free downloads they can listen to that give a sense of what an iRest entails through an 8-minute, 10-minute, or 20-minute practice. I've got several books and a number of recording offerings that can help a person learn the approach in the comfort of their own home. And we're actually doing research right now with a 42 meditation practice I've developed so that veterans, people with post-traumatic stress who might not want to go into a doctor's office or a clinic can engage these practices in the comfort of their own home, learn them sequentially, incrementally, slowly over time.
That sounds very useful.
We're trying to make it user-friendly.
I would say that's about as user-friendly as you can make it. We pretty much talked about PTSD today and the use of your techniques with PTSD. I know that one of the new fronts for you of research and user-friendliness is using the iRest program for surgery, pre-surgery, post-surgery, and I think maybe you should come back and we should do a show on the application of iRest for physical problems and surgery in medical settings.
I mean, we just did a study with elders to help them with depression and sleep. We're doing a study, it looks like with bone marrow transplants, people going through the stress of a transplant or through cancer treatment. We've done over 35 research studies with all sorts of healing modalities. So we're interested in this conversation. Absolutely.
Well, great. Then we'll just call this part 1.
It's a delight being with you.
Thank you so much. It was such a joy to have you talk about this work.
Well, thank you, Lisa, for having me on.
Thanks for listening to today's show. The Groundless Ground podcast is now available on iTunes, Google Play, and Stitcher. To find out more about this episode, see a list of upcoming guests, or get in touch, visit groundlessground.com. Now let's dedicate our efforts to the healing of our planet and all its inhabitants. See you next time on the Groundless Ground.